Hi, it's Dr. Morazy with Minutes for Moms here to give you more practical pediatric advice. Today we are going to talk about how to prevent swimmer's ear. What swimmer's ear is, it's an infection of the skin that lines kind of your ear canal. It's typically due to leftover water in your ear canal. So this is going to kind of give you tips to help prevent that. Now, what is most important is that you have to have an intact eardrum. What that means is you can't have a tube that was placed by an ear, nose, throat doctor, or you can't have a hole or a perforation in your eardrum. If so, that is an entrance into the middle ear, and the drops that you're going to put in will damage your bones that go into that middle ear. So if you've got a hole in your eardrum, you need to follow kind of the advice of what your doctor's going to tell you. But a lot of times what they have you do is they have you wear earplugs as well as some sort of headband to keep the water out. But if you've got a completely intact eardrum, what you do from a swimmer's ear standpoint is you need to kind of help dry that ear canal out. So typically what happens is it's not because I got splashed in my ear in the bathtub or when I took a shower. That typically does not give a swimmer's ear. What usually gives a swimmer's ear is as I'm swimming and I dive off the diving board and I go down as I'm coming up, I get that fluid that kind of gets in my ear. Or if you're playing a game and you're diving down to get the swim bars or whatever that brings you to the bottom of the pool and kind of then back up, that is typically when you start to get the increased risk of swimmer's ear. So what happens is that water gets into that little kind of crevices. It doesn't completely come out. A lot of times you'll do this to try to get it out. Sometimes that frees it, but still there is some leftover risk of water in your ear. So what you do to prevent that from then becoming swimmer's ear is you will then at the end of your day of swimming, it doesn't have to be every single time you get out of the pool, but at the end of your day of swimming, you're going to put rubbing alcohol in your ears. So what you can do is you can just get kind of like your bottle of rubbing alcohol, and your child puts their head on their lap. You take that, you put a quarter of a capful, and you pour it in their ear. Take a washcloth, flip them over, put another quarter of a capful, flip them over, and then they go their merry way. And that's how you can dry that ear canal out. The other thing that they have, something that is over the counter as well, are like, it comes in a bottle similar to this, and they're swimmer's ear drops. Kind of the active ingredient is alcohol as well as white vinegar. It's 1-to-1 with that, and what you do is you can use that, and the nice thing with that is it's really, really convenient, because then all you do is you go bump, 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 you go here, and now you've completely gotten rid of that risk. The nice thing that I start to use this is when my children got a little bit older, they were a little bit more mature and had that responsibility. If they swam that day, those kind of drops were in their bathroom next to their toothbrush. So when they brush their teeth, if they swam, they know that they needed to put those drops in. And that's really how you prevent the swimmer's ear. What is also important is you don't put this rubbing alcohol in an active swimmer's ear. The way that you know you have swimmer's ear is when you physically touch or when you pull or when your pinna kind of gets pushed like this and it hurts, and that's how you know that that skin is infected. Don't put rubbing alcohol, because that's like putting alcohol on an open sore, and that really, really stings a lot. If you do have swimmer's ear, you definitely need to see a primary care provider for prescription ear drops to get rid of that infection. So the thing you need to remember is you never use these alcohol ear drops if you do not have a completely intact eardrum. So if you've got a hole in your eardrum, you will use those earplugs as well as the band. You put rubbing alcohol, you do it at the end of your day of swimming, and you make sure that you do not put this in your ears if you have active swimmer's ear. So hopefully that gave you nice practical pediatric advice. Once again, I'm Dr. Morazy with Minutes for Moms. Now you know what I know. Until next time, thanks. Bye.